lastly, we're going to look at how clinicians could potentially adapt their practice to be more effective and to engage with the arts as well as a tool for healing. So one of these things is acknowledging the bravery of seeking help. It's scary to ask for help. It really, really is. But it's really important that we're reassured that seeking help was the right thing to do and that our need for help, our need for support is valid. So that's really, really vital. Also, it's important to understand that there are deep reasons for our seemingly extreme responses. So Marsha Linehan describes people with BPD are like people with third-degree burns over 90% of their bodies. Lacking emotional skin, they feel agony at the slightest touch or movement. So when we look at it like this, our response is in proportion with the feelings that we're experiencing. If you imagine somebody touching your hand if the skin is burnt versus whether they touch your skin, your hand when you've got healthy skin, you're going to respond differently. So it's really important to focus on the cause and the reason for the response rather than just looking at the behaviour. So validation is so important. It's really important to acknowledge how intensely we feel things, how intense our pain feels, even if the trigger for our response seems relatively insignificant to you. It's important as well to not say, oh, everyone feels like that, it's normal, because in reality that's not true. Like, we do feel things far more intensely and deeply, and that is really important to acknowledge that. It's important as well not to take things personally too much, if possible. We do feel things intensely and we may have distorted perspective of the situation. There may be times when we say things or do things that could be quite hurtful, and I'm not endorsing that at all, but it is important that you try not to take that too personally in the heat of the moment. Showing basic empathy and kindness is kind of a given, but it's so vital to just show it genuine interest through what you say, how you say it, through your body language, like simple things, but we really do pick up on these things very, very easily, sort of hypersensitive in that way. Another thing that you could do is offer a metaphorical paintbrush. So as I mentioned in the slides earlier about art therapy, many of us can find it a lot easier to use art or writing or even objects to express ourselves. And so if we're struggling to talk, you could always ask if we feel more comfortable writing or drawing instead. It's really important as well to know your role, to be aware of what level you're working at and what you're trained in. Like, for example, I'm not an art therapist, so I will not encourage people to dig up their issues through the art workshops that we run. I'm not equipped to deal with that. That's for the art therapist. So it's really important to be really clear with that. So yeah, safety first. It's really important to understand as well that BPD doesn't affect us all in the same way, that we're all really different and it will play out differently in all of us. There's 256 combinations of the 9 criteria that are used to diagnose BPD, and we've all got unique personalities. Pretty much all of us will have at least one comorbid diagnosis, so all of these things are going to impact how BPD plays out in our lives. So it's worth realizing that and not expecting us to be like all would be the same. So identifying our coping mechanisms is also really, really key. So helping us to identify what's helped us in the past, whether that's a bike ride or watching a film, phoning a friend, doing some art. Again, don't assume that one size will fit all, but it's really good to find out from individuals what helps them and to be able to encourage us to do those things.